Okay, so antibiotics, let's start with this. So first of all, some general terms about antibiotics or antimicrobials, okay? Some general important terms. Selective toxicity refers to the antibiotic ability to kill or inhibit a pathogen without causing damage to the host tissue. Okay, selective toxicity. All right, so that's what that means. Okay, and basically, obviously, the more selectively toxic an antibiotic is, the better it is. Therapeutic dose. This refers to the drug level that is required to treat an infection. Okay, toxic dose is the drug level where the drug becomes toxic to the patient, meaning it starts to produce side effects. Therapeutic index, this is the ratio of toxic dose to therapeutic dose. Okay, therapeutic index. So these are important terms. Any questions on the slide? Okay, very good. So again, in chapter 5, we talked about controlling microbial growth, meaning we in chapter 5 basically what we talked about is killing microorganisms in the lab. In chapter 20, we're going to talk about killing microorganisms inside the body, which is why we're talking about antibiotics. Side effects. Side effects is basically when a drug produces unwanted effects on the host or on the patient. I'm not sure if somebody has a question, but if you have a question, just make sure you unmute yourself and ask me a question. Narrow spectrum antibiotics. Narrow spectrum. These are the types of antibiotics that target a narrow range of pathogens. For example, they will only target gram-negative pathogens, gram-negatives. Okay, for example, only target gram-negatives. Broad-spectrum antibiotics, these are types of antibiotics that have a wider range of spectrum, meaning they can target gram-negatives, for example, and gram-positives. Okay, any antibiotic or any term that ends with the word cytal, a cytal agent is an agent that kills the targeted pathogen, whereas a static agent, this is a type of agent that reversibly inhibits bacterial growth. Okay. Before I go further, the only thing that I'm going to be interested in teaching you guys, because these are the most commonly used, are antibiotics that are used to treat bacterial infections. You are not required to know antifungals, nor are you required to know antiviral medications. Okay? All right. How do we measure the effectiveness of an antimicrobial drug? Okay, the effect of an agent varies, and it varies based on the concentration that you are using, varies on the type of microbe that you are targeting, meaning is it classified as a high resistant, intermediate, or a low resistant microbe, and obviously it also depends on the host patient, meaning is the patient immunocompromised or are they immunohealthy. So the effectiveness is expressed in two ways. Minimal inhibitory concentration. This is the lowest concentration of the drug which prevents growth of the pathogen. Okay? And it's also expressed as the minimal lethal concentration. This is the lowest concentration of the drug which kills the pathogen. Which kills the pathogen. Okay? This next table or this next slide, this is where all your questions or a lot of your questions are going to come from for the next exam. Okay? A lot of your questions are going to come from here. Now, what this chart is showing you guys is the different mechanisms of action. I abbreviate mechanism of action MOA. These are the mechanisms of action that different classes of antibiotics work in order to kill bacteria. I'm going to tell you guys this: if you are still weak and unfamiliar with the anatomy of a bacterial cell, this chapter will be extremely difficult for you. Okay? All right. So, antibiotics, how do we classify them? We classify them based on their mechanism of action. Okay? We have antibiotics that are cell wall synthesis inhibitors, meaning anything that falls under this mechanism of action includes antibiotics that will somehow disrupt the cell wall integrity of bacteria, and that's how it kills it. What belongs under this are the following classes. First, we have the beta-lactams group. This is the class of antibiotics that basically have a beta-lactam ring in their structure. The other that falls under this mechanism of action are the glycopeptides. This only includes only one, which you guys have probably heard of it, which is the vancomycin. Vancomycin. That's a famous one. Okay? And then finally, you have the bactricin. So these are the three classes that are considered cell wall synthesis inhibitors. Okay? And then under the beta lactams, we have different categories. Okay? Different categories under the beta lactams. We have the penicillins or the natural penicillins, which we're going to talk about. We have the aminopenicillins, for example, ampicillin and amoxicillin. We have the penicillinase resistant penicillins, methicillin, nafcillin. We're going to talk about these. Anti-pseudomonal penicillins, cephalosporins, carbapenems, and monobactams. Okay. Okay. Um, Penicillin G. Okay. Penicillin G. Penicillin G usually has a spectrum against gram-positive bacteria. Okay, gram-positive bacteria. Okay, we're going to talk about these. I'm just introducing things. Okay, so now we have other bacteria that have a different mechanism of action through which they kill. I'm sorry, antibiotics. We have we have other antibiotics that kill bacteria through different mechanism of action.